Choosing the best one for your health can be a challenge. We'll explore the DASH diet, the Mediterranean diet, and other popular weight loss programs, and offer tips on how to make a smart choice. Also ahead, the Ozempic weight loss trend. We'll talk to a woman who used the diabetes medication to help control her blood sugar and shed pounds. And finally, the foods you eat may not just increase your body fat, but could also secretly store water. We'll share 7 secrets to losing water weight safely. First up, with so many diet plans to choose from, which is the best option to lose weight and improve your health? Registered dietitian Connie Dykman looks at the pros and cons of the most popular eating plans.
This is not just about cut my calories, lose the weight. It is about a healthy you.
Registered dietitian Connie Dickman says intermittent fasting, where you restrict eating to certain hours or days, can help you eat less, but may not meet all of your nutritional needs.
If you're only eating for 8 hours, are you getting your fruits, your vegetables, your whole grains, your lean protein, your dairy?
And Dickman says there's not much research on the long-term effectiveness of intermittent fasting. The keto diet, which severely limits carb intake, has been shown to promote weight loss and may offer some heart benefits. But Dickman warns it's high in fat and eliminates healthy foods such as whole grains and many types of fruit.
It's definitely hard to do it in a healthy, sustainable way. You're going to get some monotony in that diet, and clearly you're going to have those nutritional deficiencies.
She says if you choose to go keto, don't load up on bacon and butter, and instead opt for healthy fats like avocado and nuts. The Mediterranean and DASH diets consistently rank high among healthcare professionals, including Dickman. These diets are similar and focus on fruits, vegetables, whole grains, healthy fats, lean protein, and low-fat dairy. Research shows they not only promote weight loss, but may also lower your risk of heart disease, diabetes, and some forms of cancer.
You get that health benefit, and then the weight loss might be an extra perk, as opposed to you focusing only on weight loss and compromising your health.
Dickman says no matter what diet you choose, changing your eating habits takes time.
Set one goal at a time, work through it. When you're successful, now you feel more empowered to do the next goal and the next goal and the next goal.
Ozempic, a drug used to treat diabetes, is gaining attention as influencers and Hollywood A-listers promote it as a miracle for weight loss. Off-label use of the drug has skyrocketed in recent months. Senior Health Day correspondent Mabel Zhang spoke with Mila Clark about her firsthand experience using Ozempic and how it affected her health and weight.
Hello, you're watching Health Day Now. I'm Mabel Zhang. Ozempic, an injection that keeps blood sugar levels in check for diabetics, also slows digestion and makes you feel fuller for longer. In general, prescribing physicians say it works that way for practically everyone. Sounds good, right? That's why celebrity and social media hype has triggered a shortage of this medication for more than 4 months and counting. Dr. Holly Lofton is here. She's a board-certified weight management physician specializing in obesity medicine at NYU Langone Health. Dr. Lofton, thank you so much for your time.
I'm happy to be here, Mabel. Thank you.
Is Ozempic more effective for some people than others?
So the scientific name of Ozempic is semaglutide, and it's a peptide that replicates a hormone that we already make in our intestines called GLP-1. And that stands for glucagon-like peptide, for the very scientific minutia of it. And basically what GLP-1 as well as semaglutide and Ozempic does is it goes to different areas of the brain and blocks hunger signals. It goes to your stomach and slows down the rate your stomach empties. And it hormonally helps your body be more sensitive to the insulin that you produce, thus helping your fat cells shrink.
Social media posts are suggesting that anyone can shed a lot of weight rapidly on Ozempic. Is that true?
Looking at the studies with regards to weight loss, which were done with semaglutide under the name Wegovy, which is a higher dose than Ozempic, but the same compound, we saw almost 90% of patients get some weight loss, about 5% weight loss To put that in perspective, that's a 200-pound person losing about 10 pounds. So yes, it's effective for some weight loss and mostly everyone, but patients really want that 20% weight loss. This is more like a 200-pound person losing 40 pounds because they feel their clothes are less tight and they feel as if they can move through the world or easier. So while it does work for most people to some degree to get the desired weight loss, it really differs because it has to be the right mechanism for you at that particular time to help you with actually shedding pounds.
These drugs for on label and off label use have been around for about 8 years in different forms to help treat obesity and being overweight as conditions. So, why the frenzy now?
I think just the popularity has grown, both with the advent of the drugs on social media, but also just word of mouth. We see people going out to their offices and others commenting on their weight loss and then going back to their doctors. But of course, you can reach many more people with social media with one post. So that's why the big boom right now.
Will there be an even bigger run on the drug at the start of this new year? Because that's when a lot of people set their resolutions to lose weight.
I do expect to see some uptick after the holidays. We have about 40 million people with obesity and overweight, and we have about 11 million people in the US with diabetes. The problem is we all have limited access. Patients can't treat their weight, which can cause other problems. Patients can't treat their diabetes, which can cause long-term problems. Some patients are in both groups and they really can't get the medications that they need. They have lapses in care, and that can lead to, a backtracking of progress that they've made. So when we're using these medications, I really think it's just the general public. If the companies can't meet the demand, which I'm glad the demand is great and people know about these, then we really need to reevaluate how these pharmaceutical companies are allowing us, as well as insurance companies are allowing us to have access to these much needed drugs for multiple conditions.
Dr. Holly Lofton, board certified weight management physician specializing in obesity medicine at NYU Langone Health. Thank you so much.
Thank you, Mabel.
Well, things can go awry even for the most seemingly perfect of candidates for this type of medication, like Mila Clark, who has latent autoimmune diabetes and blogs for the diabetes community. She writes candidly about struggles with her weight and chronicled taking Ozempic for her 30,000 YouTube followers. Founder of HangryWoman.com, Mila Clark, thank you for being here.
Thank you. I'm so excited to talk to you today.
Mila, you blogged about your experience for nearly a year. How much weight did you lose when you started on Ozempic?
I dropped about 10 pounds within a month, which was a lot for me personally. Usually I had to work really, really hard to lose 10 pounds. And so for me, it was a pretty quick weight loss. And I was also just like, this is really weird because I'm not having to try very hard to do this. And so as I kept going on, I kept noticing that like the weight was just falling off.
Wow. Okay. And then what happened? Did you experience any side effects?
There are gastrointestinal side effects. You can get a lot of nausea, diarrhea, you can feel dizzy, you can experience heart palpitations, which was something that happened to me.
How fast was your heart rate while taking the medication compared to what it normally beats at?
I could be laying down in bed and my heart rate, like resting heart rate, would be 120 beats per minute. And so now, not taking it, I'm looking at like 70 or 72 beats per minute when I'm resting, which is pretty normal. So it was really having an effect on my heart rate, and that was really terrifying.
And that eventually led you to stop taking the medication. How much weight had you lost by that time?
At that point, I had lost about 35 pounds. And that was a year after I started taking it. So I personally was really happy with that. I thought that that was a great kind of end goal for me. I noticed that my blood sugars were doing better after I had lost that weight. But my concern and my fear was that, okay, I had taken Ozempic and lost all this weight over this year. Am I going to gain it back? Is it just like, is taking the injection the only thing that's helping me, or like is my body actually like working for itself?
And what was the case when you eventually stopped after 10 months?
I was actually pleasantly surprised. So when I stopped taking it, I thought that I would immediately just gain the weight back, and I didn't. I actually ended up maintaining my weight for a little while and then even losing a little bit more. So total, I've lost about 50 pounds.
Were you tempted to stay on the medication because you were having such success with it?
It was really tempting to continue it because it's such an easy medication to take. But then for the flip side, it was like, even though I'm seeing these great results, I feel awful all the time. I don't feel good. I don't have any energy. I feel sick and nauseous, and that's not quality of life.
How do you feel about the craze surrounding Ozempic and the enormous demand, not just from people who have diabetes, but people looking to lose weight?
It's kind of unfortunate in two ways, I would say. I think on one hand, semaglutide, which is what Ozempic is FDA approved for obesity treatment. And so there are people who are using it for weight loss for health purposes. And I think that that is amazing. And especially like with my own experience, knowing how helpful it can be. On the flip side, I've seen things like the Ozempic challenge on TikTok, where it's people who are at a pretty normal weight. Maybe they have like 10 pounds that they want to lose because of some reason. From what I've seen, it's usually vanity purposes. And so they're using Ozempic. And I think that that has a really big impact on people with diabetes because we're not able to get the drug at this point. There's so many shortages and there's like a lack of production of Ozempic, but this increased demand because people are seeing that it works for weight loss really well. And so now people are stuck not being able to fill their prescription at the pharmacy. And you know, people with diabetes aren't using it for vanity purposes. Like losing a percentage of your body weight can help with insulin resistance. And having in-range blood sugars is the difference between developing complications and not, or being able to manage your blood sugars and not deal with some of the horrible things that come along with having diabetes.
Author, YouTuber, founder of HangryWoman.com, Mila Clark. Thank you.
The DASH diet is one of the most highly recommended diets for health and heart disease prevention. It's actually designed to lower blood pressure. But what can you eat on the DASH diet? Here's more from Health Day TV. What is the DASH diet? The DASH diet is one of the top diets recommended for overall health and heart disease prevention. DASH stands for Dietary Approaches to Stop Hypertension. The diet is often prescribed by doctors to help treat high blood pressure, but that's not the only benefit. Since its introduction in 1997, studies have shown the DASH diet helps lower the risk of heart disease, kidney disease, and type 2 diabetes, improves cholesterol levels, and helps with weight loss. The DASH diet is a flexible eating plan that sets daily and weekly nutritional goals for specific food groups. The plan emphasizes fruits, vegetables, and whole grains, fat-free and low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils. It recommends limiting fatty meats, full-fat dairy, tropical oils, sugar-sweetened beverages, and sweets. Choosing foods low in saturated and trans fats, lower in sodium, and rich in potassium, calcium, magnesium, fiber, and protein is also key to success with DASH. While food quantities may vary based on body size, a 2,000-calorie diet-a-day diet could include grains, meats, poultry, fish, vegetables, fruits, low-fat and fat-free dairy, fats and oils, sodium, nuts, seeds, dry beans, and sweets. Drinking water does more than just quench your thirst. It's essential to keeping your body functioning properly and feeling healthy. But too much water can cause uncomfortable bloating or other negative effects. Here are some tips for losing water weight efficiently and safely. Cut your salt intake. Avoiding the salt shaker at mealtime is a good start. Also, try eating fewer processed foods, which can be loaded with hidden salt. Back off the carbs. Carbs are stored in the muscles and liver as glycogen, but each gram of glycogen comes with 3 grams of water attached, so eating too many carbs can lead to bloating. Exercise regularly. Yes, you can sweat out water, but exercise also improves circulation, which reduces fluid buildup. Plus, working out burns off that stored glycogen energy. Stay hydrated. This may seem counterintuitive, but water boosts kidney function and aids in flushing excess water and salt from the body. Make sleep a priority. Quality shut-eye helps your body regulate many functions, including your hydration level. Try a B6 or magnesium supplement. These supplements help the kidneys flush excess salt from your system. There's also evidence they help reduce bloating and swelling caused by PMS. Ask your doctor about a diuretic. These pills increase urination, which lets your body get rid of excess water. They're often prescribed for high blood pressure and should not be used for weight loss. Adults with obesity who can't lose weight despite strict dieting may need to add exercise to their program, researchers say. While a diet-focused approach to weight loss does not work for everyone, exercise has been shown to decrease fat mass. Here's more on the topic.
Exercise may be the key to losing weight if the scale isn't budging, even when you stick to a low-calorie diet. Researchers say they've discovered a subset of adults with obesity who are diet-resistant. They reviewed thousands of medical records and recruited 20 women with obesity to take part in their study. Half of the participants had trouble dropping pounds despite adhering to a strict eating plan, while the others did not. The women were asked to take part in a closely supervised exercise program using treadmills and weights 3 times a week for 6 weeks. Body analysis at the end of the program found exercise decreased fat mass and boosted skeletal muscle metabolism in the diet-resistant group only. The researchers say these findings show a diet-focused approach to weight loss does not work for everyone. One author says, the message for a diet-resistant patient with obesity is clear. You are in a group of individuals for whom exercise is particularly important, and that's really going to help you lose weight.
I'm Sydney Murphy. You've been watching Health Day Now.